Hey guys, welcome back to Medical Coding with Blue. Okay, today's episode is going to be a day in the life of a remote medical coder. Now, I'm going to preface this video with this. I am a medical coder. These are my opinions. These are things that have happened to me. And the reason that I say this is because I have been getting emails from people who have been saying that my topic title is not what I'm talking about in the video. So I want to make it clear. I am a medical coder. This is a day in the life of. Okay, this is the day in the life of a remote medical coder. Now, I have done remote medical coding in the past. I haven't talked about it very much because a lot of people seem to get very excited about remote medical coding, and it sort of takes away from sort of passing along more knowledge about medical coding itself. I think that when you have something like remote coding and you can do it from home, and so sometimes the topic of medical coding just sort of gets switched off and, ooh, let's talk about being at home. Okay. I just want to make it clear that this was my experience as a remote medical coder, and I'm going to talk about it today. So let's go ahead and get into it. All right. Now, being a remote medical coder does require you to have experience already. And I will explain it further as the video goes along because you'll be able to see what I mean when I say you need to have experience. There are a lot of people who are brand new medical coders who want to get into it simply because they want to be remote medical coders. Here's the thing with this. When you are a remote medical coder, you have to know what you're doing already. And there are a lot of remote medical coding companies. I have never seen one say that they are willing to take on a brand new medical coder with no experience. It's important to already have experience because when you are at your house, there's not going to be a coworker that you can turn to and say, hey, can you help me with this? Or go down the hallway and talk to somebody there to help you with it, or talk to the doctor and ask them what do they mean by this. Everything is going to be by email or by instant message or maybe in front of the camera. It's very sterile. It's very sterile when you're working remotely, okay? The company that I did work for, they did send me a computer. They sent me a computer and they sent me another second monitor, so I had two monitors. And I had to clock in with their system. There was a clock-in system with them. And they paid for my internet, which was a nice bonus. And I got just access to a lot of different resources. Like I had to use a 3M encoder. And so I had those resources to use. It was very... I loved it in the beginning because it was very autonomous. I had a lot of autonomy when I first started. Like literally, they just told me, work your hours, make sure you complete your hours by the end of the week. You had from Sunday to Saturday, and you can work any time during that time as long as you get your hours done. I was like, okay, if you say so. So some days I would work longer, some days I would work shorter, and some days I was off, you know. And sometimes I would get overtime, and that was always nice. And the thing about it is you have to be diligent and you have to be responsible. I live by myself, and so my whole house is secure, you know. I didn't have to have that where I have to set up like in a little corner or anything like that. My whole house is secure because it's just me. And so because it's just me, I had to make sure that I got clocked in on time, and I had to make sure that I did all of my work. I would work in a queue. So all of the workflow would go into a queue. I did same-day surgeries. So it was literally all surgeries that I did. And I did some other procedures, some outpatient procedures, but mostly it was all same-day surgeries. And it was, I mean, to me, it was nice. It was a really good learning experience. And I always say it was like the Marine Corps of medical coding because literally you had everything. And these were like level 1 trauma hospitals that I was coding for. And to work for a level 1 trauma hospital, you have to be really good with injury coding, because you're going to see injuries all the time. And not only that, you see very complex cases, like very, very sick patients who have lots of things going on, or very complicated disease processes going on. So you have to be very familiar with knowing how to go, which path to go when you're coding. And because I had so much autonomy and I could work whenever, I was working in the evening, or I would work on the weekend, which there was nobody hardly on staff, which was fine for me, because that would mean I could move through the queue quite quickly, and I wasn't having to trip over a bunch of people. Whereas if you were coding during the daytime, like during 8 to 5, you'd have a bunch of other people that were working remotely as well in the same queue at the same time. So it just depends on what setting that you're coding for when you are coding from home. Not everybody does same-day surgeries. Some people do outpatient office visits. Some people do inpatient coding when they are working remotely. So it just depends. In my circumstance, I was working for same-day surgeries. Anytime I had a question, I just had to wait until I could get a hold of my manager to talk about it with me. And she was shocked a lot of times to see how many traumas I had to code. But I had to code a lot of traumas because a lot of people that were coding during the day would skip those trauma records, so they would be all left in the evening, so I would have to take care of them. And to me, it's not a big deal, but it is wrong to skip, okay? If you are working from home and you're doing that, it is wrong. Not only are you impacting your fellow coworkers, but you wouldn't want somebody doing that to you. So that's just my point on that one. It is a privilege to work from home. It's very free to work at home. It's freeing, okay? But at the same time, you are by yourself and you are spending long hours alone. And while, yes, this may be a dream come true for some people, when they think it's such a great thing and then they get into it and all of a sudden it's like, uh-oh, this is really bad. I'm really lonely. Yeah, you do get lonely. I didn't really get lonely. I just didn't like the disconnectedness of not being able to talk to my providers. Anytime I did have a query, the query got, I would have to fill out this query form, and then it got sent in, and the nurse had to field it first to see if it was worthy to go to the doctor. Oh, no. That's not the way this works. At least not with me. When I am literally in person in the hospital, oh, no. I'm not going through your nurse. No. We go mano y mano. I don't go through your nurse. I don't deal with the nurses. And I don't have a problem with the nurses, but they're not the ones that can correct this issue, okay? And I'm not going to sit here and argue with the nurse either on whether or not this or this, okay? I'm the medical coder. This is the way that I need this information, not something that I can infer. I'm not going to infer anything, because if it's not documented, it didn't happen. And I have spent many a time arguing with the nurse. Well, it's there. No, it's not. It's not clear. When it's not clear, it did not happen. And I'm not going to risk being cavalier about picking up diagnoses because you don't want to do your job, which was pass along the information to the provider, which is why I don't like that disconnectedness. If it was more of I could be with them and I could talk with them and then maybe like be at home later, maybe, but not really. I just prefer to be with them. I like being with my doctors. I like being with my PAs. I like being with them. And the reason that I like it is because it builds that good relationship. I am going to be posting another book that is from my own private library about body language, that if you have a chance to, hopefully you should check it out and read it. Body language is a secret weapon when it comes to dealing with your providers, and being in a facility or being in a doctor's office is very important to have those skills. But getting back to remote coding, I really liked that the autonomy part of it to a degree. I still had to maintain keeping up with like continuing education units, and I still had to do continuing education for that particular company, okay, which was like HIPAA. I had to do that, and I had to do a few other things as well. There were times when like the workflows didn't come in fast enough, so we had to work on those continuing education exercises and things. We had to work that. And sometimes your internet is out, and sometimes like if a storm hits or something. And I didn't really have too much problems with the internet, thankfully, but I know that there was some people who had issues with connectivity. And when you have literally the computer and you have to plug the computer from the computer into the modem, box, it's just you can't use Wi-Fi, and that was the thing. They were very clear about that. You can't use Wi-Fi. I did have to get drug tested working for this company, and so that was an interesting experience as well. I mean, I don't do drugs, so this was not an issue for me, but it does go to show you that they are going to be very particular about who they hire when they're hiring for remote medical coders. If you have had experience in working in a hospital and you are considering working from home, if the reason that you want to work from home is because you want to get away from your coworkers, that may be good and it may be bad. If you want to get away from a particular bad situation, then working from home would probably be good for you, because not everybody gets along. Not everybody at work can get along, and different people do things different ways, and sometimes people are not as professional as they should be. And because of this, it does lead to stress, unnecessary stress half the time. I did for a while have a very stressful situation in my workplace, and because I was working in a very tight quarters, in a room full of 20 women, and it was very difficult, and I wanted to do anything and everything I could to get out of that room, where it was too many women. For me, it was just so many women, and not that women are bad, but sometimes they get very catty. And it's just like, ladies, we just need to get to work, and then you see them with their phones and you see them not applying themselves, and it's on the supervisor to deal with it. But at the same time, when they become distracting and you have your headphones in and you can still hear them, it just, I don't know. To me, it's just like, well, and so changing your environment may be more helpful for you. So, but it is nice to not have to go anywhere, and you can just start working just like that. And if you can find a remote medical company that will let you, remote medical coding company that will let you work any hours that you want, that's even better. That's sweet. That's a sweet deal. Like, you can just get up and you can work whenever, or you can start in the evening, or whenever you feel most awake. That's nice. That is really nice. So, but yes, it is not for everybody. I will just say that as well. I didn't mind it. Like I said, I didn't really have a problem with it, other than the fact that it was just, just working from home. Let's see, what else can I say about that? You do have your monthly coder meetings where you all have to like dial in and listen in on a meeting, and any topics that are going on, things. So you get to know the other people, the other people that you technically work with. But other than that, I mean, it was, you learn a lot. I mean, it just depended on the setting that you're working in, but it is very, very, very imperative that you already have experience before you start working from home. And I mentioned that this was like the Marine Corps of medical coding because that coding for those hospitals was extremely tough. And my accuracy was very high compared to other people because it's something that you got to be paying attention to detail. And that was one thing that I did get rewarded on for having attention to detail. I did very well. I did get bonuses for that. And so because of that, you know, it's always nice to be recognized for doing something really well. And you know, so that was pretty much it on that. When you are remote medical coding, I mean, you will have questions, but if you reach out to, you know, your manager or, you know, another coworker, it's all going to be by instant messenger. So just something to keep in mind, because sometimes explaining something, even written, can be misinterpreted. I know. Sometimes even saying it on video can be misinterpreted. I know, because I've had a couple of things misinterpreted by some viewers. And I've had to like go back and say, no, it was this, this, and this. And so sometimes people don't quite understand because everybody learns differently, everybody thinks differently, and everybody's situation is different. So sometimes if you are stressed out, you're going to interpret things a lot more differently, you know. So if you're feeling overwhelmed, you know, especially if this is the beginning for you and you've got all this information coming at you, of course it's going to be something new and different, and you're going to feel those overwhelming feelings of like, oh my gosh, what did I get myself into? It's part of it, and it will get easier after a while. But that was my thoughts on that, and that was my experience on that. Okay, everybody's experience as a remote medical coder is different. I'm just saying, but I'm telling you all, this was my experience. This was what I went through. This was my day as a remote medical coder, going through the queues, working the lists and coding and just meeting my quota. Okay, every day, and that was it. So very straightforward, very simple. It is usually the same thing when you are working, whether you're working at home or whether you're working at an office. You go in and you work the queues, and the queues have all of these encounters that are supposed to be completed. And once you complete them, you move on to the next one, and then you move on to the next one. And then when that system is down or you have to do something else, then you work on your continuing education, and there's usually like a area of the website maybe that has that where you can work on continuing education. So, you know, it just all depends. It all depends on where you're working. So, yeah, so that's it. And I guess I will go ahead and wrap this one up. But, yeah. So if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all on the next video, and tune in tomorrow for Q&A Tuesday. We'll close it up. Bye-bye.